Hey guys, welcome back to the Bearded Dentist, and today we are going to be pulling some premolars on a 13-year-old female. This patient is about to get braces, and the orthodontist has made the judgment call that she does not have enough arch space in order to fit all of her teeth. So he decided that these specific premolars need to come out so we can create enough space for the rest of her teeth to fit comfortably and fit in a nice even arch form and straight line. So these are typically pretty easy. Patients typically do very well with these. You would think a 13-year-old getting 4 adult teeth pulled would be pretty traumatic, but honestly, most of them do very well with it. The hardest part is getting them numb. I have to do 8 shots in the mouth for this, and so it's just, you know, that's kind of the worst part. But like I said, most of them power through it pretty well. So I don't do a lot of elevation with these because these teeth really aren't usually at this age totally set in that bone yet. They are, but I've found that it's pretty easy to just get in there, give it a little wiggle, and then go in with this kind of figure 8 situation you're seeing here with an ash forceps and just wiggle it right out of the socket. This tooth right here, um, we as we were removing it with a forceps, the throat pack or the gauze kind of got in the way, so I just fast forwarded through that and wasn't really able to get a good shot of pulling this one out. But I'm going to take this spade elevator and I take that and I poke it around the gums on either side to make sure the patient's numb. And then I like to get it and dig it right in between the teeth there, right on the bone that holds up and has a nice collar around that tooth. I dig that spade in there because the tip of that spade will kind of dig that bone out of the way and allow me to get a nice purchase point for the next elevator. Sometimes I don't even use that next elevator. So here's where I fast forwarded. As you can see, the throat pack there is kind of getting in the way. And instead of stopping and, moving all that, and this is a 13-year-old girl, we just want to get her through the appointment. We don't, for the sake of filming, not trying to have her sit there any longer. So that tooth's out. These are the bottom premolars now. These ones were, these are usually typically fairly easy. And again, not a lot really to discuss with these too much here. Just poking around on either side, make sure they're good and numb. Just do a little bit of elevation. I do not waste a lot of time. Some dentists will sit there with these and elevate and elevate and elevate and you're really just putting a lot of pressure on the adjacent teeth when you're doing that, and I just don't find that necessary with these specific extractions. Her premolars, it's hard to tell this one, but the two on the bottom here are a little bit awkwardly shaped. They're very, very wide and they're a little bit rotated, about 30 degrees each of them. You'll see the next one, you can definitely tell. Um, I am elevating this one a little bit more because it did have a little bit of a hook at the bottom of the root there. So just to make sure we don't have anything snap off, because that's the worst case scenario, is if that root breaks halfway down or 2/3 of the way down and we got to go digging for it. That's when these 15-minute appointments turn into 1 hour appointments or what have you. There's a little bit of editing. I cut out a little bit of scenes here, but I think this whole thing took about 12 minutes to get these 4 teeth out after getting them numb, and that's with packing gauze and doing all the other stuff. So if you're still here in this video with us, I do want to say, I appreciate everybody that's liked and subscribed so far. I know I've mentioned cameras a lot in my other video. There is a camera that I can mount directly to my loops or the fancy magnifying light that sticks on my head. That's like a $3,500 camera though, so I would like to do that because I can get shots like this, but without a lot of this kind of shakiness and a lot of everything getting in the way. You would see exactly what I would see, which I think is a lot better of a view than kind of what you're seeing here. There's that premolar, that goofy looking premolar. But anyways, and that's another reason the orthodontist picked this, these specific teeth on the bottom is, and any tooth that have weird anomalies or are misshapen, those are better to remove. So anyways, back to my camera. my eventual goal is to get that camera, and I could make much better videos with that, and you can see exactly what I see. But that takes a lot of money, and you guys liking and subscribing and helping me along that way. It's free to do, definitely helps me out. But hey guys, if you've watched this far, thanks for watching. Thanks for sticking with me, and I hope to see you at the next video. Have a great day.